Now I would like to welcome Dr. Valerie Parkas. I have asked her to talk a little bit about her background, so I'm not going to give a big introduction, but I did want to mention a few highlights, such as that she received both her undergraduate and medical degrees from Brown, that she is on the staff of the Icahn School of Medicine at Mount Sinai and has been involved in their clinical care and their medical education from the start of her career there. She is also noted for creating an innovative program called the Longitudinal Clinical Experience, which she will mention to you as well. She has received many awards, and in 2009, she became the Associate Dean of Admissions for Icahn School. And this makes Valerie the perfect speaker for our program today to discuss the non-traditional path to medical school. So Valerie, welcome.
Hi, thank you, Heather. Thanks for the introduction. Hello, everybody. It really is a privilege to be able to speak to you all around the country or wherever you are, from New York City, where I am. So a few words about me, and then we can talk more about med school admissions, which is what I do on a daily basis. So I did go to Brown for both med school and undergrad, and after that I came to New York and I did an internal medicine residency and a fellowship in infectious disease. At the time, it was really the height of HIV medicine, and there was a lot of HIV-infected patients, and I decided that I wanted to specialize in infectious disease and take care of a vulnerable population who at that time was quite stigmatized, and that's really how I picked my specialty. After my training in infectious disease, I came straight to Sinai, where I've been since 1997, doing both clinical work in infectious disease, and now I primarily take care of HIV-infected inpatients and outpatients, as well as doing a lot of work in the medical school. I've been the Associate Dean of Admissions for the med school for the last 4 or 5 years. I also have worked in the med school teaching clinical medicine. I was the course director for a course called the Art and Science of Medicine, which is a doctoring course that most med schools have, in which I had the privilege of teaching all the first-year medical students how to talk to patients, communication, history taking, physical exam, health policy, medical ethics, a lot of important sort of professional clinical skills, and I did that for close to 10 years, and I still run a small group in that course. So a little bit about Sinai. We are in New York City. We're ranked in the top 20 of medical schools. We have a lot of community service going on. All of our students participate in advocacy and take care of the patients in New York City and in Harlem and East Harlem, where we have the privilege of working and being located. 100% of our students also participate in research, all different types of research, from bench research to clinical research, translational research, community-based research. And we have a lot of NIH funding and a lot of opportunity for students to become involved in both research and service. As I said, we're in New York City, and that really has a big impact on our students because they are so engaged in our community. So I'm going to stop there about myself, and I'm going to turn my attention to what's much more important, which is, I think for many of you, since you're called into this webinar, you're probably contemplating or thinking about, or definitely thinking about, applying to medical school. And I have the privilege, since I've been the Dean of Admissions for Sinai, of being on a lot of panels with a lot of other admissions professionals from a lot of schools, a lot of med schools across the country. So I have a sense of what different schools are looking for. I have a sense of what we're looking for, obviously. And many schools are looking for similar things, but schools also look for particular aspects because different schools are different and they have different missions. So I think the most important thing when you're thinking about applying to medical school and you're thinking about how to make your application, but most importantly make your person the best it can be, or you can be, for this application and for this process, is to think about the attributes that you would want in your physician, or more importantly, the attributes that society needs in their physician workforce. Because I think as an admission professional for a med school, what we really think about is the future workforce of America in healthcare, or really not just America, of this world. So we have to think about our global need for physician scientists, our global need for physician educators, our global need for expert clinicians, for physician leaders, for people who have expertise in public policy or public health, finance, and they integrate that with medicine. So I think we are often thinking about what our global needs are and what are the attributes that we need in our physicians of tomorrow. And I think if you think about your application in that way and you think about the activities that you're engaging in as you start to think about applying to medical school, it becomes much more clear what activities make sense to participate in, and what attributes you want to show through your activities. So it's also critically important to think about the schools that you're interested in, because different schools are different. And it's important to figure out what each school's mission statement is. So this is the mission statement of the Department of Medical Education at Sinai, or Icahn School of Medicine at Mount Sinai. We want to graduate physicians and scientists who are prepared to enter society as informed advocates and activists, able to advance clinical care and science, and capable of promoting change. So I think that is a unique mission statement, because we have the words physicians and scientists, advocates and activists, promoting change. And I think as you look at different schools' missions, there are schools whose missions are very, very focused on rural medicine. There are schools that are very, very focused on physician scientists, and there's schools that are much broader. And you have to sort of think about what are the attributes that this school may be looking in, and how does that correlate with their mission. I think that's very important to do as you're looking around at schools. So the admissions committee at Sinai has looked at and thought about what attributes we specifically want in our applicants, in our accepted students, and our incoming class, and in our graduates, and in the physicians of tomorrow. And this is the list that I will read quite quickly, but we're looking for students who are adventurous, collaborative, committed, creative, curious, disciplined, empathic, innovative. We want students who are leaders. We want students who are motivated and passionate and resourceful, resilient, tolerant, self-aware. We want them to have a social conscience, and we want them to be lifelong learners. So I think many of these attributes can be seen through many, many different activities. It doesn't only have to be specific activities that you think about with medical school, like research. You can learn about these attributes and show these attributes and build these attributes through many, many different activities. And I think that's important to think about, especially if you're thinking about med school maybe and a non-traditional path, after perhaps thinking about some other careers, or dabbling in other careers, or having very established other careers, or doing post-bacs. So those are the attributes. That's the mission statement of one med school in the top 20. Mission statements are different, as I said, and it's important to look at them. Those are the attributes that we are looking for at our school, but again, different schools might have different attributes. Many of them probably are similar, but it's important to think about them. So once you think about those attributes, then these are the categories, at least at Sinai, that we look at when we're looking at applicants or at applications. We look for academic excellence, and I'm going to get into each one of these in more detail. We look for a commitment to clinical medicine. We look at students' research experience and their service activities. We look at their intangibles, which is a group of activities that don't fit into any of these other categories. And we are very, very committed. And it is a huge priority to have a broadening and sustaining of diversity. So let's drill down a little bit more into each of those categories. So again, when you think about academic excellence, it's important that you reflect upon the attributes. So what do I mean by that? What I mean is, if you're looking for innovative people who have initiative, or are curious, or are creative, you're going to look for students who have taken some risks, who have pushed themselves, who have taken the hardest courses in a topic, who have pursued a major or a concentration, as you say at Brown, with an intensity and a passion that really shows that they're committed to something, because you're going back to the attributes again. So it's important that we look for, and that the applicants have shown us, that they have an academic passion, that they present their intellectual journey, that their narrative makes sense, that they took some opening courses in their freshman year and something really resonated with them and they pursued it, and perhaps they became a TA in that course, or perhaps they did a little bit of scholarly work with the teacher in that concentration, or perhaps they wrote a thesis in that concentration. We want to see them pushing themselves. We don't have specific undergraduate concentrations that are more important or better suited than others. We like students to have all different undergraduate concentrations, but we want to understand why it is they pursued what they did, and we want to understand where the intersection of their academic focus is with medicine. So if it's health policy, we want to see in the application how that intersects with your future career in medicine. If it's biochemistry, we want to see how that intersects. If it's Spanish, we want to see that. And we can see that in a number of different, many, all concentrations, but we want it to make sense. We want the intellectual journey to make sense. So what about the metrics? Definitely look at the metrics. We look at MCAT, and we look at GPA, and we look at undergraduate major, and we look at undergraduate institution. But again, we look at these things because we want the students to be successful when they come into our school. They become part of our community, part of our family, and we want to know that they're not going to struggle when they get to medical school. So yes, it is important to take the MCAT and do well, but it's most important to take it when you're ready, to give yourself a chance to study well, to not take the first one as if it's just a practice, right, because we see them all. It's important to be ready in each section because we don't just look at the overall score, but we look at each sub-score. And it's important that you've shown some acumen and strength in your science GPA. Now, we are not punitive if there is a time when a student struggled, especially if it's early on in undergraduate coursework. We understand that sometimes the transition from high school to college can be hard, and we understand that for many non-traditional applicants, for freshman year, sophomore year were very, very long ago. So we tend to not dismiss those, but we understand that it was a long time ago and that a lot has happened since then. With respect to academic excellence, there are specific things one can do if one feels that their undergraduate GPA shows a bit of struggle, and there are graduate degrees that people can take. They can do post-baccalaureate degrees, they can do master's degrees in science, and I will get more into graduate degrees later on in the presentation. What we want to see is that if you struggled in an area, say biology or chemistry, we want to see that you took another higher level course later on that shows us that you will not continue to struggle, that you have become, your studying has become better, and you sort of understand where you missed in the previous time. I'm going to stop there if there are questions about academic excellence, anything specifically that I touched upon.
Nothing in specific, except I did want to address, we had a question that came in previously about, I wasn't a science major, I was a political science, and, now as I'm out in the real world, I'm reconsidering, and so how would that person sort of address this path? Can you use that as an example?
Right. So it sounds like a person, thanks Heather, who did not necessarily take pre-med requirements. So that person either needs to get their pre-med requirements done at another school where they're currently living because they've already graduated, it sounds like, or they need to do an official post-bac program. So if you do an official post-bac program, and many schools have these programs, that's a little bit sort of more organized. You have built-in curriculum, you have a built-in group of friends who are doing the same thing as you, you have built-in advising, you have a built-in person who's going to write your committee letter from your post-baccalaureate program. The curriculum builds upon itself. It's just a bit more organized. You can also, of course, just take the requirements at a school, and that might be more of a financial, that might present less of a financial burden than doing a whole post-baccalaureate program. The post-baccalaureate programs do tend to be a little bit more expensive. It is important that you take your pre-med requirements, if you haven't taken any of them, at an institution that is academically on par with where your undergraduate was. And it doesn't mean that it necessarily has to be if you went to Brown, an Ivy League institution, but it should be a good institution where we know, the med schools know that you're getting good science education. But again, you can do that. So you can take all of your pre-med requirements through a post-baccalaureate program, and we have a ton of students who are doing that these days. Or you can just take them at another school, not through an official post-baccalaureate program.
So there had been some questions, too, about, how will it look if someone does it at a community college? And, so what I'm hearing is that the academic weight is definitely upon that.
Yeah, I think that we understand that there are financial barriers, and we understand that if you already went to undergrad, you probably have loans, and you probably are now working, and so you're maybe independent of your family, whatever your own situation is. So we make adjustments for everyone's individual situation. We look at every application uniquely. That said, there should not be a pattern of taking everything for your pre-med requirements at a different school, like especially if you're doing it at the same time as when you're an undergrad, so that you're taking all your courses at a, quote, maybe less good school over the summer. That looks as if perhaps you're trying to figure out the situation a little bit and get one up on us. And you just have to be aware of that. Now, again, we understand, we completely look at every applicant. So we know when there are logistic issues, you need to be home taking care of a family member, you need to be working and contributing to your family, you now have children. I mean, there are unique situations that allow us to understand things. But again, it probably, if you're able to do it at an institution that's equivalent or through a post-baccalaureate program where you have the built-in advising and structure, that I think allows you all the benefits of that structure and that advising, and I think that's probably beneficial.
Mm-hmm. There's a couple of questions coming in, and one I think you're going to get to, but the other one I just thought we might address here since it's on the screen is, can a strong MCAT score make up for a lower GPA?
It's an excellent question. A strong MCAT score is always good. We like to see an MCAT score where the sections are fairly, all of them are good. So it's not that one very strong one makes up for a weak one. We want to see excellence in all the sections. I think it depends. The undergrad GPA is more, it's more complicated than just sort of binary good or bad, right? It's again more complicated. We know each person has a different set of struggles, challenges, priorities. So there are many, many students who came into college perhaps not having the best advising or science in their high schools, and so they struggle when they first get to college freshman year. So sometimes we will look at an undergrad GPA, and we have basically on the AMCAS application, which is the application that everyone fills out for medical school, we get the following information. We know your GPA total. We know your GPA total for all 4 years of college, and then we know your GPA for math and science versus all the other classes for all 4 years. So we can say, okay, the student's undergrad science GPA is a little bit low, but it's because freshman year was a big struggle, and since that time it's been stellar. And we know, for instance, that the person writes that they had a difficult time transitioning to college or something like that. So I guess my answer is it's a little bit more complicated than just can an MCAT make up for a, quote, bad GPA. I think a bad GPA is not necessarily a bad GPA if it's someone who has particular reasons, took a very, very hard major. Much of the struggle was only freshman year, and we can kind of make sense of that. If there's just a pattern of doing poorly in the sciences for all 4 years, then we're worried that you're going to struggle in med school. And even a great MCAT can't make up for a concern that you're going to struggle academically in medical school, because, again, it's hard on everyone when people struggle in med school. It's hard on the person specifically. It's hard on the school because you're part of our community and we want to graduate the best medical professionals into this field. So I would say if you have a GPA that you're worried about, you need to take some more courses somewhere to show us that you will not struggle in the science courses of medical school.
Good points.
Any other questions?
I think that's it for now. There's a couple that I'm going to save to the end because I'm noticing the time, and I want you to be able to get through everything.
So I'm going to go, so academic excellence is one category that we look at. What are the other categories that we look at? We look at a commitment to clinical medicine. Again, think about the attributes. We want to see students who are passionate and committed to medicine, and the only way that we know, and more importantly, the only way that the applicant, the student knows that they're committed to clinical medicine is if they've been in a clinical arena, some sort of clinical arena, been exposed to human illness, been exposed to healthcare, been exposed to some sort of healthcare suffering or medical suffering. It sounds strange to say, but the only way that you know that you want to take this leap and go into this career, which is so rewarding but is certainly also hard, is if you've put yourself in a clinical arena. You've been either in an emergency room, a clinic, a hospice. You've worked on a hotline for suicide prevention. You've been in an ambulance with an EMT. You took your athletic skills and you worked with the athletic trainer on your team for hours and hours. You worked in a pharmacy. Any of this can be done in this country. It can be done abroad. It can be rural. It can be urban. It can be with a nurse practitioner, a doctor, a pharmacist, a physical therapist. But you need to be in the clinical arena with acting like a provider, volunteering as a provider in some way so that you get that provider-patient relationship and you can talk about it and it can become something in your heart that you know you want to do. Because the most important person who needs to know that they want to do this is you. Now, there are many people who have to work, and so it's hard to just volunteer. You can work in a nursing home. You can work in a pharmacy. I have had a lot of applicants who maybe didn't have 150 hours in an emergency room, but they took their time that they needed to work and they did it in a clinical arena. Okay, it is important that in your personal statement and in your interview, somewhere in your application, you're able to discuss some sort of impact of this experience, and it's probably most important on your interview. There is no question that someone in your interview and at these schools is going to say to you, have you ever been in a patient-provider relationship? Have you seen patients? What impacted you? What was the most surprising? What was the most challenging? What did you feel was the hardest? Some question like that, and you need to be prepared to sincerely discuss that. So again, it's very important that over this time, especially if you're on sort of a non-traditional path, that you took the time to spend in the clinical arena. People will say, I don't buy that over the last 5 years he or she has done nothing clinical when they say they want to be a doctor. If they really, really, really want to be a doctor, they would find a way to get into a clinical place. So I think that's very important. So the first two categories that we look at are academic excellence and a commitment to clinical medicine. I'm going to go on unless there's specific questions about clinical medicine experiences.
There's just one asking, is it important to have full-time experience or consistent clinical volunteering sufficient?
Oh, no, it doesn't need to be full-time at all. And again, any experience on these applications, the most important thing is that it's sustained. It does not have to be full-time, but we love when you do something and you do it for a long period of time, when it is sustained, that you committed to it. Again, think about the attributes. I hate to sound redundant, but when someone commits to something and they have a sustained experience, that is what we like the most. Students who dabble in a little of this and a little of that, it doesn't look quite as robust in the application. So it does not have to be full-time at all. We understand that people have other obligations and they're going to school.
Great,
so,
thanks.
The third category we look at, so academic excellence, clinical exposure, research. Research is not a required activity for admission at most med schools, but it is at some. And again, you have to go look at the med school's mission statement. If their mission statement talks about scholarship and research in the mission statement, it may be that those admissions committees do want research. We look at research and we like research a lot. And if a person has had no research in their application, we probably want to see other areas that make up for that are extraordinarily robust, that are very significant, like leadership and service. But when I say research, students can have basic science research, they can have clinical or translational research, but they can do public health research, medical education research, community-based participatory research, health policy research, and students, and I often get the question, students who majored in a social science or a humanity who have done a major research project or a thesis in that area, that is considered scholarship, and you should point that out in your AMCAS application as a scholarly project, as a research project, as an area where you focused at your academic passion and really looked you researched an area, even if it's not biomedical research. If you've done a lot of research, you need to have a letter from the people you worked with. And so sometimes people will spend a lot of time, a year or two in a lab, and then we don't have a letter from the PI on the project. We find that to be a little bit concerning. We like to see an evolving role in any experience you have, including research. Like, we like to see that perhaps if you started out working as a technician, that you then evolved into having a little bit more of a autonomous role, and you understand everything about the project that you're doing. No matter what you put in your AMCAS application, and this is true for research or clinical or service, you need to understand the large picture of the project and the smaller. So we've had students who worked in a very small segment of a big research project, and perhaps they were simply entering data, and that's totally fine. You got to do what you got to do, but you need to understand what the point of the project was, and you need to know what happened on that project. If a person is intellectually curious, which is one of the attributes, they would never just leave the project and not find out what happened. So anything that you put down, you need to know everything about, because the interviewers are going to ask you, and they're going to assume that you will know, and they're going to be concerned if you didn't know. So again, research is not a required aspect on med school applications, but if you have it, it can be a wonderful, wonderful addition. And we like to see sustained experiences, and we like to hear why this experience impacted you. When you write up any experience, use the little space that you have to write, this was impactful to me, or I learned a lot, or whatever happened to you, that why it was a positive experience. You need to put that down. Tell me, tell us, because we don't necessarily know that specific research that you're doing. You need to explain it to the people reading the applications. I'm going to go on. So we talked about academic excellence, clinical experiences, research experiences, and service. So if you look at the Sinai mission statement, it's clear that with the words activists and advocacy, that we are very committed to the community that we have the privilege of serving. And so it is basically required at Sinai that you have done some advocacy, that we believe this is an advocacy profession, and it is critical that you are engaged in community service. Again, we like sustained experiences. We like you to explain what you did in that AMCAS application, because again, we don't know every service organization at every college. You need to tell us. We like to see your role evolving, just like we discussed on research. We like to see that maybe you've had initiative and you've had some leadership. We want to hear your narrative. It doesn't have to be that everyone's doing the same service. It might be that you're interested in health policy, so you work somewhere helping people figure out their insurance barriers, and it might be that someone else is working in a sport that they did in college, and they're teaching that sport to children. It can be really any service-oriented, anything that, as long as it's personal for you and it makes sense in your narrative. But again, if you're going into an advocacy profession, it makes sense that you would have done some advocacy in your time before entering medical school. I'm just going to move on to a category that we call intangibles, which essentially is other activities that are not under clinical, academic excellence, research, or service. And we take these very seriously, because if we go back to the attributes, students who have been committed to a sport or committed to drama or committed to some other activity for years and years and years, I often say since they were 5 years old, and they took it to a new height, and they worked hard, and they learned teamwork and focus and commitment and resilience, We want to know about that. Those are the students who are going to come in and transfer those attributes straight to their medical career, to their advocacy, to their science, to their scholarship, to their research. So we want to know about those activities, and there are a myriad of those activities, right? Students who spend hours and hours and hours writing and editing the newspaper. We want to know about that. And those are undergrad experiences that I'm talking about, and I know we can see a lot of those through other post-college experiences. But again, we want to know what you have done and think about the attributes. We can look at and find those attributes through numerous activities. So when we're putting together a class, it's very important that we have 140 first-year medical students. It's very important that there are 140 different voices, different opinions, different views, different backgrounds. We are looking for educational diversity. We're looking for ethnic and racial diversity. We're looking for people who have diverse professional histories. We want people who have diverse desires in their career going forward. Again, we talked about physician scientists, physician educators, expert clinicians, people who are working in health policy and the interface of medicine and policy. We want all of that. So therefore, we want people who come in with diverse educational backgrounds. So if you have an unusual or a non-traditional, as they call it, background educational path, harness that and make it a strength. So some of the different paths that we see a lot. We talked a little bit about post-baccalaureates. We get a lot of students who have done post-bac programs. The post-bac programs, some of them are career-changing post-bac programs, so people who basically went to undergrad, majored in something, had a career, and now decided they want to go to medical school. It is, and then they do a post-baccalaureate program where they get all the pre-med requirements. It's very important that whatever that other experience, whatever that previous career was in finance and consulting and teaching and arts, we want to hear what made you change, what made you have an epiphany that you wanted to be in medical school, and can that be harnessed and intersected with medicine aid? It can't always be, but it can many times be. It might be that your finance background, you now want to do some health economics. It might be that you really learned from teaching, and that you realize that that medicine is essentially a teaching profession, and that attendings are teaching and residents are teaching, and that's the part of medicine that you want to become a clinician educator. It may very well intersect, and if it does intersect, I think it can really help you professionally and as well as for your application to talk about that intersection. Graduate degrees. Graduate degrees, if you have academic success in them, can be wonderful. So there's students who get master's degrees in biomedical science, and they will then improve their application because now we know that they will be successful in the sciences. Now, it is important that you know that a post-baccalaureate program or post-bac courses go into the undergrad GPA. They enhance the undergrad GPA. A master's degree just gives you another GPA. It doesn't enhance your undergrad GPA, just if you're thinking about your numbers. If you get a graduate degree in a master's in public health, I think that's a wonderful, wonderful degree, and we love people who have MPHs. But it has to be because you're interested in public health. It shouldn't be because you want to boost your GPA, because it's a very, very different way of thinking, and because you did well in your public health degree does not mean that you're going to do well in some of the first-year medical school courses. So if that's the reason that you're doing it, that's probably not the right reason. If you're doing it because you wanted work in public health, then I think that is wonderful, and the degree I wish I had. We love students who have done work in the military. Again, we have a lot of students who were doing medical work in the military, and then that's how they got excited about medicine, and that trajectory and that narrative makes a lot of sense. So there are a lot of paths, but it's important that you think about your particular narrative and that you show it to us in your application because it's probably a wonderful narrative. again, I touched on much of this, but as you're thinking of your narrative, it's important that you stress the lessons and skills that you learned from either your previous career or your previous time in the military or whatever your previous effort was. It's important that you stress that you're a mature applicant who has had all this experience and has maybe this other graduate degree or got a master's in bioethics or got a master's in another humanity or whatever, and why those lessons learned and skills attained are going to work to make you a better physician and a better medical student. We want to see all that. You should stress it because that is your strength. Instead of thinking of it as a negative, think of it as a strength. However, if you have changed careers multiple times, that's of concern because then we worry that it's a person who just dabbled, and we want to know that you're committed to medicine. So if you have made a career change, make it clear why you changed to medicine and that you're committed now to medicine. And as I have said numerous times, talk about the intersection of what you've done with your future medical career. I'm going to stop. I'm going to take
You've done a great job. Thank you for all this wonderful information, Valerie. A few questions that are coming in and a couple that you and I discussed that had come in previously that I thought we might just revisit. A couple of the questions were, if you think you want to be in medicine, but maybe this is not, you're not sure exactly want to be a practicing doctor, what are some alternative paths that you've seen people take?
Well, I think that it's a bit complicated. So there's a couple of answers. The first one is simply in the application process, you may run into a bit of difficulty if you're positive you don't want to be a practicing doctor, because you have to think that a fair amount of the people who are interviewing you are practicing doctors, and the training includes practicing as a doctor, being on the wards, taking care of outpatients, inpatients. So I think it's probably hard if you dismiss that outright from the get-go. I think it's probably more prudent to think about it as, I want to do that, I'm excited to take care of patients, but I see myself not only taking care of patients, but doing this other thing, doing something, I don't know, at the CDC around epidemiology, doing something in Washington around health policy, doing something where I actually am pretty much 100% in the lab, doing translational or bench research, right? So physician scientists typically have a career that's 80% research, 20% clinical. But I think it's hard to, I think med school faculty and people who are interviewing you, and truthfully future people who want your future to be impactful and that you're using medicine as an agent of change, want to see all that other stuff. They want to see that you want to either teach or be a scientist or be working in policy or public health. But I think they don't want you at this early stage to necessarily dismiss outright clinical medicine, because you have to do clinical medicine to get the training. And you have to have some knowledge of clinical medicine to make a difference in translational research, or some knowledge of clinical medicine to make a difference in policy, healthcare policy, or some knowledge of clinical medicine to understand, vaccine research. I'm making up all of this stuff, but whatever it is that you're interested in, you have to be excited about the prospect of learning and doing the clinical medicine, at least to augment your future career. Mm-hmm. I hope that makes sense.
Yeah, that makes great sense. At least it does to me. And lots of questions are coming in here, which is great. I'm glad to see you guys are thinking about this process. A couple of practical questions. One about applications. I've noticed that many schools require a letter of recommendations from an undergraduate professor. But what if you've been out for several years? How would you recommend handling this?
So I think it's a good question. Sometimes there is an undergraduate professor who still remembers you, who you've kept in touch with, maybe someone who you helped TA the course after you took their course, or someone you did a little research with, or someone who was your advisor, so that's one option. The other option is if you took your, you can do your pre-med stuff later. If you did your pre-med stuff later, you can get your post-bac or your science professors or your professors in general from that post-baccalaureate program. If you took your pre-med courses a long, long time ago, and yet you then didn't do pre-med and did something else, I think you probably do need to go back to that school and at least talk to the health career advisors and get some advice for them on how to handle that. Really use your pre-health advisors. I mean, I guess because we're doing an alumni careers connections at Brown, my thought is that most people on this call have wonderful pre-health advisors at Brown. So, harness their knowledge. They know a lot, and ask them what, your specific situation.
Yeah, there is actually a nice pre-health program here that anyone who's been out at least, up to 5 years could certainly contact through the Career Lab and get information about that. A couple of questions about that, too, that have come in. How long, if you've been out, is too long, even if you had a science degree, to where maybe you should still go back and take some additional coursework? So what's too much time off for it to feel like you're ready to go back and to school?
So here's an example where, if you took Orgo, you might want to sort of get yourself into the whole school thing. And sometimes students who have been out of the school thing for a very long time struggle at the beginning of med school because they haven't studied in a while. Their study habits are kind of a little bit dusty. They haven't taken a multiple choice test in a while, right? All of these are learned skills. So it might not be unreasonable to take either biochemistry or molecular biology, sort of an advanced course. That might be a good option to, A, get yourself ready, and B, sort of prove to the med school that you are ready. However, if you decide not to do that because of time or money, you have the MCAT, right? The MCAT has to be recent. Every school has a deadline for which they will no longer accept old MCATs, right? 2 years old or 3 years old. So by definition, if you graduated, even if you graduated 6, 7 years ago, your MCAT is more recent. It has to be about a year or two old. So if you have a strong MCAT, we know you are current in your knowledge base. So I wouldn't worry about that.
Okay, yes, a couple of those are coming in that are 10 years maybe. And then another couple of questions were about how, when is it a time when it's too late to start medical school?
Not from a dean of medical education. It's not a dean of admissions. It's not, we don't have a line in the sand, as they say. However, from a personal sort of doctor perspective, it's a long training, and you want to know that you're doing all this work so that you have a career that's long enough, that it feels rewarding and impactful. So I'd say the short answer is there's no line. The long answer is the residency and the fellowships are extraordinarily physically and intellectually challenging. And I think if you're doing them when you only have a career that's going to be less than a decade or whatever, I think you need to think through, is there another way that you can feel rewarded and feel fulfilled professionally? If there isn't, then you have to understand that you're going to go for it, and that you're going to be tired, and you're going to work hard, and that it's going to be a bit all-consuming. However, I think if that's in your heart, your passion, then you go for it.
Do you want to talk at all about, a couple of questions are saying, maybe I'm not sure, or maybe what I really love is the providing care. or yes, I want to be able to get into this a little quicker. Now I'm a little older and I want to switch, but maybe I don't want to wait 10 years before I can practice. Could you talk about some alternative medical programs like nursing degrees or?
Well, I mean, I think I probably can talk about them with a less educated brain than others, but I will give it a go. I mean, I think that the medicine is a team sport, and the other professionals that physicians work with, from nurses and nurse practitioners to physical therapists to social workers to pharmacists to physician assistants, are part of the clinical team in a very robust way. And there are fields out there where the physician assistant is really doing hands-on, rewarding, impactful work. Same with the nurse practitioner, the nurses, all of the professions that I just listed. On my team as an HIV doc, the nurse and the social worker are critically important, to the point where I will sometimes leave the room and go get the social worker and say, can we talk to this patient together? So I think it depends a little bit what it is that is pulling you towards medicine, and you have to think, are there other ways that I can get the reward and the satisfaction and the professional, I guess, empowerment and fulfillment that I want through a slightly different path. If it's the advocacy, the one-on-one advocacy that you want, it might be that social work it makes sense. Again, these professions are part of a team, and I think the hierarchy in medicine is really historical, and now the team members are our peers, and we work together. So I think there's a lot of wonderful careers, particularly, nurse practitioner, physician assistant, social work, nursing, physical therapy.
Great. And those are some of the questions and some of the ideas that people are throwing out, which, okay, if I'm not quite sure, maybe this is the programs I should consider. There's a bunch of questions coming in, so I'm trying hard to read through anything that's different than some of the ones we've already talked about. One of the themes that keeps coming up, and I think you've made that clear, but I just thought we could reiterate, is that does there seem to be any sort of bias or negativity now for people who do a post-bac? And I think it's so accepted. It's what people do. Most people are taking a time off. Is that correct?
The short answer is no. There's no bias. I think actually there's I think that, again, if you can talk to that same intersection and what you've learned by doing it this way and your maturity, I think actually it's enhancing of an application in a lot of ways. But you still need to go do all the other things that everyone who's applying is doing, right? Research, right. Service, clinical exposure, etc.
Mm-hmm. And the one thing I wanted to mention, too, is a couple of the questions about alternative degrees. There is a Brown alum who's done some volunteering for us who I think went to Mount Sinai, named Abbas Gupta. We actually have highlighted him. And he went to medical school and then decided to change careers. And now he lives out in California and does venture capitalism. So, people definitely change careers, and that's part of why we have this series and this service that we provide to you. So if you're considering, you can, test drive it through the webinars or any of these programs. I think that is most of the questions that we can cover here today. Just one more question is there, and I think, again, you're covering a lot of this too, but because I hear from you that at least at Mount Sinai, you're looking for a pretty well-rounded. Do you think that, and you really seem to be interested in the community service, do you think that that's indicative of most medical schools nowadays, or is that something that's very particular to Mount Sinai?
I think that, again, different med schools are different. I think that different. There are med schools that are a little less forgiving in some areas, with a little bit of a misfire in one course. There are schools that will not take someone if they haven't done research. So I think different schools are different depending on their mission. I think that we are looking for basically passionate and innovative students, and that can be in a bunch of different arenas. So if it's a biomedical engineer who then spent 2 or 3 years doing, device development, that's their passion and that's their path and that's the intersection that they're going to use with medicine. So I think we're looking for all different students, but all of them have to have had a narrative that makes sense and goes together and where they pushed themselves.
Mm-hmm. Well, thank you for all of this great information. One last question that I thought might be helpful, a question about if you're already in a master's program or if you've in public health, but you'd already submitted some of your applications. Is it important to go back and talk about that, or would that look like a divergent path?
No, a public health degree is not a divergent path at all. It's exactly an excellent path. But it's important to say what you're doing for the year if you already applied, if that's what you're doing. It's important to give an update. It's important that the schools know what you're doing for the year. And it's a wonderful degree, and you should use it to your benefit because it shows, talk about how you're going to use medicine and public health together, how the synergism of the two degrees. Yeah, it's great.
I really appreciate all this information. There are a couple of very specific questions that we will try and get you at least some sort of response. We do have them, and I appreciate everyone who has participated today, especially you, Valerie, for helping us out here.
I appreciate all your help, so thank you for inviting me. It was a privilege.